creation of Miriam Hyman Children Eye Care Center in Bhubaneswar is a perfect example of how a hatred can be turned into love. It began with terrible London bus bombing on July 7, 2005. One of the girls affected was Miss Miriam Hyman. Her family thought differently to take care of this terrific incident.
My sister was Miriam Hyman, who was killed in the London bombings on the 7th of July 2005. And since then we've been working hard in her memory to raise money.
From the money collected from the British government and their private philanthropy, they created a foundation, Miriam Hyman Memorial Trust. They started looking for helping people in the world. In that search, Mrs. Hyman was able to contact Dr. Rao in 2007. Mrs. Hyman thought about Bhubaneswar because she was born in Calcutta and grew for a while before she migrated to United Kingdom. And Miriam was a school teacher in front of a lot of lovely young children. The time Mrs. Hyman contacted Dr. Rao, we were already thinking of building a children eye care center in Bhubaneswar. Her phone call cannot be more appropriate and more timely than what it was.
During our search for an organization which is dedicated and which has a system of transparent working in the interests of small children, we heard about L.V. Prashad and about Dr. Rao, and our wavelengths simply matched.
Vision loss in childhood is a blindness for entire life. Globally, there are 1.4 million blind children, and approximately 20% of the world's blind children live in India. Before 2008, there was no dedicated children's eye care center in eastern part of the country. It was only after establishment of Miriam Hyman Children's Eye Care Center that the world-class screening program for pediatric cataract, strabismus, retinopathy of prematurity, and eye cancer in children were ever introduced in Odisha. The Miriam Hyman Children's Eye Care Center has a unique feature of child rehabilitation and sight enhancement for differently abled children. Daily, we screen around 70 to 80 children for various eye conditions.
ये मेरी बेटी हंसिका अग्रवाल है। इसके कुछ आँखों में प्रॉब्लम हो रहा था और बहुत सारे थेरेपीज किए कर लास्ट में सर ने सजेस्ट किया कि इनकी सर्जरी होनी ज़रूरी है। तो उसके बाद में हमारी अच्छी रिकवरी हुई। बच्चे ने भी खुश हो गए कि हाँ मेरे विजन्स ठीक हो गए हैं। यहाँ जो स्टाफ है सब ने बहुत अच्छे से कोऑपरेट किया।
मैं डॉक्टर विवेक अंकल की तरह एक आई डॉक्टर बनना चाहती हूँ।
Miriam Hyman Children Eye Care Center has created a lot of ripples. It attracted a lot of other compassionate people to contribute. One of the important contributions came from Mr. Mridhari Dalmia when we formed a part of the Miriam Hyman Center organization called NEHA, standing for Newborn Eye Health Alliance. The Miriam Hyman Center also goes out to reach people at their place. A small underweight, underage baby who might have got retinopathy of prematurity lying in a sick bed of neonatal intensive care unit cannot reach out. We go to the child and examine the child there in that hospital, not only in the city of Bhubaneswar or the district of Khurda, but surrounding several districts of Orissa. The government of Orissa recognized this center as the resource center for all children eye care problems. Last year we examined 153,000 plus children in a district called Rayagada in Orissa. This is the biggest boon that Hyman family could have done to not just L.V. Prasad Eye Institute but the entire people of Orissa and the surrounding region.
Knowing that Miriam Hyman Children's Eye Care Center has impacted millions of lives and enabled small children to see this beautiful world gives us immense satisfaction.